Now, Guinean authorities are closely working with international partners to combat against the newly resurgent Ebola disease in the country. Health authorities say the new outbreak could affect the efforts to contain COVID-19 pandemic, and residents in Conakry also expressed their concerns of the situation. Guinea is among the West African nations that were hardly hit by the first outbreak in 2013. More of that in this report.
The country is once again facing a new wave of the Ebola virus.
There will be a fact-finding mission sent to demarcate the area that is incriminated and the villages of all the people who took part in the burial ceremony in order to identify contacts and isolate them. Afterwards, there will be a second mission that will take some time to be able to provide the answer to the source of this new outbreak. This mission will seek to find out whether it is an old disease that has awakened in the body of the patient or whether it is from wild animals such as bats that are incriminated in the genesis. We also made contact with the WHO. This time we are going to use our fatal weapon against Ebola, which is vaccination.
The World Health Organization is sending 11,000 doses of Ebola vaccines to Guinea.
Support will be deployed across all pillars of the response, including coordination, care and support, infection prevention and control, surveillance, community engagement, risk communication, logistics, human resources and finance. We will rapidly deploy capacity to support Guinea, which already has much more experience.
Nearly 11,300 people died in the Ebola epidemic that gripped Guinea between 2013 and 2016. The deadly virus has re-emerged as the country struggles to contain COVID-19. Health experts say the new outbreak is likely to impact ongoing efforts against the coronavirus.
This impact can be seen through the psychological state of the affected populations in Nzerekure and through the general concern of Guineans about this very dangerous Ebola epidemic. In addition to the psychosocial impact, the resurgence of Ebola will impact the country's economy as the government will spend more money. The National Health Security Agency is also obliged to carry out additional site-oriented strategies, and all these activities and equipment are expensive.
Growing concern continues to plague the residents of Conakry as the country ramps up its Ebola response.
When the virus appeared in 2014, things were not easy, especially for us who live in the interior of the country. Every day there were deaths, which is why we are worried.
I am very worried, and I hope that the government will immediately take every adequate measure to circumscribe the second wave in the Nzerekure area so that the virus does not spread throughout the entire territory as it did in the first time.
Guinea's health ministry said all confirmed cases had been isolated. These reported cases of Ebola virus are the first in West Africa since 2016.